All right, let's dive into one of the most mysterious and fascinating parts of our own bodies, the gut. We're going to take a tour of some of the strangest, wildest conditions that can pop up down there, and you'll see how doctors have to be detectives to figure this stuff out. Let's get right into it. So, right off the bat, I have a question for you. What in the world could a coffee bean possibly have to do with a trip to the emergency room? It sounds totally random, I know, but it's a real clinical clue. And we are absolutely going to find out the answer as we explore what happens when things go wrong in our digestive system. Okay, first up, we're talking about the body's classic alarm system, inflammation. These conditions are some of the most common reasons for gut trouble, so you've probably heard of them. Let's think of them as the gut's usual suspects. And of course, the headliner, the big one, has to be appendicitis. It's a classic for a reason. We all have this image of a teenager grabbing their side, but honestly, this can happen to anyone at any age. And it all kicks off when something tiny, maybe a bit of hardened stool or some swollen tissue, creates a blockage and sets off a really dangerous chain reaction.
So here's exactly how that chain reaction goes down. First, you get the blockage. Then, all this fluid gets trapped inside the appendix, and the pressure just builds and builds and builds. It can get so intense that it actually chokes off the blood supply, and the tissue starts to die. That's when the inflammation goes wild, and you get that classic sharp pain in your lower right side. It's amazing how fast it all escalates from such a tiny problem.
But hey, appendicitis isn't the only inflammatory game in town. You've also got things like toxic megacolon, which is exactly as scary as it sounds, a life-threatening swelling of the colon. Then there's Behçet's disease, a real chameleon that can look a lot like Crohn's. And let's not forget diverticulitis, where these little inflamed pouches in the colon can actually form fistulas, which are basically these weird abnormal tunnels connecting to other organs, like your bladder. Crazy, right?
Okay, so we've talked about inflammation. Now let's switch gears to a problem that's purely mechanical, and trust me, it's pretty dramatic. We're going to look at what happens when your own bowel literally ties itself in a knot.
Right? So the medical term for this is a volvulus. It's super dangerous because it cuts off blood flow and causes a massive blockage. But here's the really interesting part. How it twists and where it twists can tell doctors a whole lot about who is likely to be suffering from it.
And this is where it gets fascinating. There are two main types, and they have completely different profiles. You have the sigmoid volvulus, which doctors sometimes call the grandma volvulus. You see it in older patients, often with a history of chronic constipation that stretched out the colon over years. On an x-ray, that twist points up and to the right. Then, on the flip side, there's the cecal volvulus. This is the younger person's version, happening to adults who were just born with a part of their colon that's a bit more mobile than it should be. Their twist points up and to the left. So cool, right? Two totally different stories for the same basic problem.
And boom, this is the answer to our question from the beginning. The coffee bean sign is the classic buzzword for how a sigmoid volvulus looks on an x-ray. That huge, swollen, twisted loop of bowel forms a shape that looks just like a giant coffee bean. It's an unmistakable visual clue that lets doctors make a super fast diagnosis.
All right, so we've seen the common stuff and the dramatic stuff. Now, let's open the cabinet of curiosities. We're diving into the truly strange cases, the ones that make you go, wait, the human body does what? This is where it gets really weird. So, first up in our cabinet of curiosities is the appendix mucocele. I want you to imagine that instead of getting inflamed and infected, the appendix just inflates. A little tumor starts pumping out this jelly-like stuff called mucin, and it fills the appendix like a water balloon until it gets absolutely massive. So how on earth do you spot something like that? With another fantastic visual clue, of course. This one is called the onion sign. When they look at it on an ultrasound, the layers of that jelly-like mucin that have built up over time look just like the rings inside a sliced onion. It's an incredible, super specific clue that points right to this diagnosis. Next up, we have something that's way smaller, but man, is it painful. So your colon has all these little dangly tabs of fat on it called epiploic appendages. Every now and then, one of these little guys can just twist on itself, cutting off its own blood supply. It causes this really sharp, specific pain, but thankfully, unlike a massive volvulus, this little twist usually sorts itself out on its own. Okay, for our final and maybe the strangest curiosity of all, I've got another question for you. What do you think could look exactly like a dangerous, walled-off infection on a scan, but isn't actually a disease at all?
The answer is a gossipy boma, which is just a fancy medical term for a retained surgical sponge. Yep, you heard me. An object left behind after surgery. The body does what it does best. It freaks out, walls it off, and starts a huge inflammatory reaction around it, creating a perfect copy of a nasty abscess. It's incredibly rare, but it's a powerful lesson in medical detective work.
So, after that tour through all the inflammation, the twists, and the downright bizarre medical mysteries, what's the big takeaway here? Well, it all comes down to listening and looking for the clues.
You know, as we've seen, figuring out these gut problems is a lot like real detective work. It's all about putting the pieces together, taking the patient's story, their age, their history, and matching it with these incredible visual clues. These signs, like the coffee bean or the onion, they're not just fun trivia. They are absolutely vital clues that help doctors solve the case and, ultimately, save lives.
It's just a powerful reminder that inside every single one of us, there's this incredibly complex world that has its own language. So maybe the next time you feel that little rumble in your gut, you'll pause and wonder, what story is it trying to tell? Thanks so much for joining me on this tour.